This Council resumes the second reading debate on the Electronic Health Records Sharing System Amendment Bill 2025. Mr. Tan Kan-chiu, Chairman of the Bills Committee on the bill, will first address the Council on the committee's report. Mr. Tan Kan-chiu. President, I make this report as the Chairman of the Bills Committee on Electronic Health Records Sharing System Amendment Bill 2025. The bill seeks to amend the existing legal framework of the Electronic Health Record Sharing System eHealth to upgrade its function and support its future development. The Bills Committee held 6 meetings with the administration. Members of the Bills Committee supported the bill for building up a comprehensive personal electronic health record for the public and better support the healthcare system reform. The bill empowers the Secretary for Health to require specified healthcare practitioners HCP to deposit the specified health data of a registered healthcare recipient HCR into their personal eHealth account. A number of members were concerned about the implementation arrangement of it, such as whether the healthcare recipient's HCR can request the HCP not to deposit their sensitive records into eHealth. They inquired about the support and guidance that the government has for private healthcare sector, particularly those that are less prepared for digitalization, as well as details of enforcement arrangement. The administration indicated that the specified data, specified HCPs, and the period of providing specified health data will be prescribed in the form of subsidiary legislation through amendments to the proposed new Schedule 3 of Chapter 625, Electronic Health Record Sharing System Ordinance. Before exercising the relevant power, the administration will make sure that technical support is in place and there would be adequate communication with the relevant stakeholders on the detailed implementation arrangements. The administration will also consider providing additional support or simplified technical solutions to healthcare institutions and professionals that are less prepared for digitalization. In relation to members' concern on enforcement arrangement, the administration will propose amendments to provide that a specified HCP must make available the specified health data of a registered HCR to eHealth unless the HCR has given the HCP a notice in the form and manner specified by the EHRC, Commissioner of Electronic Health Records, stating that the HCR does not consent to the provision of the health data to eHealth. The amendment will also specify that the EHRC may issue an enforcement notice to a specified HCP. If the EHRC is satisfied that the specified HCP has contravened the relevant provisions after making such inquiry as the EHRC considers necessary. The bill proposes to empower the HRC to recognize a non-Hong Kong HCP or a non-Hong Kong information infrastructure to connect to eHealth to support HCP's cross-boundary healthcare needs. If the EHRC is satisfied that the non-Hong Kong HCP or non-Hong Kong information infrastructure meets the requirements specified by the EHRC. Some members expressed concern about the security issues of a cross-boundary system, how to protect data privacy, and how to regulate HCPs outside Hong Kong. The administration explained that any recognized information infrastructure must comply with the specified system requirements and conditions imposed by the EHRC to safeguard data privacy and system security. As the bill has no extraterritorial effect, to ensure that there are sufficient leverages in place to enforce the conditions of authorization imposed and regulatory compliance in the relevant jurisdictions to adequately safeguard eHealth, the administration envisages that cross-boundary sharing and use of electronic health records through eHealth will be needed to be backed by government-to-government arrangements and agreements to be entered into with the non-Hong Kong HCPs and operators of non-Hong Kong information infrastructures concerned. Some members suggest that the administration should consider empowering the EHRC to revoke the relevant recognition under specified circumstances to protect the personal data on eHealth. In light of this, the administration will propose amendments to more clearly reflect the legislative intent, namely, if the EHRC is satisfied that certain circumstances have occurred and consider it necessary to activate the procedures for revoking the recognition of a non-Hong Kong HCP or a non-Hong Kong information infrastructure, the EHRC is to take appropriate measures to restrict access to eHealth so that no new data or information of a registered HCR may be provided by the HCP or information infrastructure to eHealth, and the electronic health records of the registered HCP is not to be made available to the HCP or information infrastructure through eHealth during the period after the notice of revocation is given and before the date on which the revocation takes effect. The bill proposes that specified healthcare practitioners will have access to health data in eHealth. Members inquired whether different professions have different access rights to health data of HCRs. The administration explained that under the need-to-know principle, in accordance with the clinical needs or functions of different healthcare professionals, access rights have been defined. Some members are concerned about the system security of eHealth and asked how the administration will make sure that the system will not be hacked. The administration responded that they will formulate stringent security policies and control procedures in accordance with the government IT security policy and guidelines issued by the Digital Policy Office, with the adoption of appropriate technologies and measures to safeguard system security and private protection. Some members have further inquired about the measures to be taken by the administration to address the issues of potential confusion in medical data arising from HCPs intentionally registering and deregistering multiple times as HCPs in eHealth. The administration advised that they will continue to closely monitor the situation, including its impact on the use of healthcare and research and statistics, etc., and will formulate appropriate measures as necessary. Besides, via various publicity and promotions, the administration will continue to encourage people of the public to build a complete and lifelong personal electronic health record profile through eHealth to support their healthcare needs and to minimize the withdrawal of HCR's eHealth registration or re-registration after withdrawal. The administration proposes to introduce a new offense relating to purporting to be or holding out as eHealth and a new offense relating to using the title of eHealth system or electronic health system, etc., to mislead others. Some members consider that electronic health system seems to be a more common term, and concerns have been raised about whether healthcare institutions would therefore be caught inadvertently by using the term to describe its electronic system. The administration explained that apart from the use of the name, there must also be an intention to mislead others to believe or recklessness as to whether to mislead others to believe that the facility is or associated with eHealth to commit an offense. At the suggestion of the Bills Committee, the administration will propose amendments to clearly reflect the mens rea element of the offense and to raise the penalty for the two offenses from a fine at level 3, that is $10,000, to a fine at level 6, that is 100,000 Hong Kong dollars. The administration will also have regards to other views of the legal advisor and the members to propose other amendments. The Bills Committee has completed its scrutiny of the bill. Details have been set out in the report submitted to the Legislative Council. The members of the Bills Committee will not be moving amendments to the bill. President, here are my personal views on the bill. President, I have to declare interest. I'm a member of the Hospital Authority and a chairman of a committee. I'm also a chairman of the management board of Margaret Hospital and Kwai Chung Hospital. I thank members of the Bills Committee for giving us their views. This bill does not only have to do with the health records of the people, it is a big step forward for our healthcare system reform. Hopefully in the future, we will be able to collect more data to compile a more comprehensive database such that we can provide more quality service to the people, lower the cost of the healthcare sector, and drive the use of technology and digital technology of the sector. I hope that the administration will make preparation in 3 different areas. First, the government should talk to different stakeholders, for example, representatives from the healthcare sector, especially during the initial phase of the implementation of the new eHealth system. I think that it's essential that the government talk to the sector. Second, I hope that the government will set aside resources for private healthcare facilities in need to make sure that their normal operations will not be disrupted. As they provide medical and healthcare services, hopefully there won't be any inconvenience caused to them just because of the new system. Third, the government must promote the system to make sure that people understand the benefits of this new system, which is for the good of their health instead of causing inconvenience. The government must step up public education to encourage the members of the public and HCPs to make better use of e-health so that we can collect more health data. President, I have been asking the government to compile a comprehensive health database. For us to achieve a comprehensive system, we must have data from the public and private sector. The e-health have been commissioned some 10 years ago. Most of the data come from public healthcare facilities. The private clinics only upload data on a voluntary basis. There aren't that many of them that do so. Also, e-health is not connected to the relevant systems on the mainland. As a result, the data on the e-health may not be comprehensive enough, and this is not conducive to the construction of a comprehensive healthcare data system in Hong Kong. Before I became a LegCo member, I've asked the administration to improve the e-health. The administration said that they will consider mandating the private doctors and private healthcare facilities uploading the health data onto e-health, but no plans or timetable have been announced by the government. As a result, on the council meeting on the 12th of July 2023, I asked the government if they have devised strategies and plans to mandate private healthcare facilities to upload health data into e-health. Some time has passed, but I think that this is a breakthrough that we have this bill tabled today, and this is a significant milestone. President, I have raised a few points in the Bills committee meetings. For private doctors or private clinics without means, we have to help them transition to the new e-health system. Many of them want to upload the relevant health data onto e-health, but they are maybe less digitally prepared, and sometimes they find it difficult to upload all the data they have onto the platform. They may need technical support, and that's why some of them did not upload relevant data onto the e-health. I hope that the government will provide third-party technical support or subsidies to incentivize all healthcare practitioners upload all their health data onto the e-health. On the cross-boundary arrangements, the bill sets out stringent requirements on non-Hong Kong HCPs and information infrastructures. The government will set out a time limit for the use of relevant data. If the government finds out that there is improper use of health data by non-Hong Kong HCPs, as the bill has no extraterritorial effect, we cannot penalize any of these HCPs. So I wonder if the administration will talk to the relevant mainland authorities to set out all rules and regulations on the use of health data. This is what many members are concerned about during the Bills Committee meetings. I hope that the administration will come up with a solution to address the issue. President, I also hope that we will encourage everyone to register with e-health. I think that the government can provide more incentives by making reference to other countries to create an e-health account for all newborn babies. Newborn babies have to be vaccinated. If all records of these babies can be uploaded onto the e-health, then they will be more motivated to use it over their lives to form a more comprehensive set of health data. I think that we should impose a opt-out mechanism by registering an e-health account for newborn babies unless their parents opt out of it. By this, we can encourage more people to form habits of uploading health data onto e-health. I hope that the administration will consider it. We ask HCPs to upload key data of patients onto eHealth just to provide the best service to them and to take care of people's health over the long term. But I'm worried that some HCPs may be reluctant to upload health data onto eHealth, and some facilities or institutions intentionally promote the fact that they do not upload health data onto eHealth to draw patients that don't use eHealth. I wonder if the penalty level is enough. Now the penalty is just $50,000 and a $1,000 for each day when the offense is committed for HCPs that deliberately do not upload health data even if they are required so by the EHRC. I think that the administration should look into whether such a situation is prevalent. I think that the government should provide a information sheet or paper so that they can explain better to patients what benefits there are for uploading health data onto eHealth. Or maybe we can send such a textual information sheet to the members of the public so that we can encourage more people to register and use eHealth on a regular basis. President, I support the Electronic Health Record Sharing System Amendment Bill 2025 and the government's amendments.
Professor Chairman Kong. President, I speak in support of the Electronic Health Record Sharing System Amendment Bill 2025. E-health is a piece of electronic health sharing system which is convenient for patients. It is beneficial for elderly patients in particular. The relevant healthcare professionals can have instant access to the basic information, including drug allergy, radiologist reports, and other laboratory test results of the patient. It will help them make an accurate diagnosis. It will also facilitate the checking of drug prescription and consultation schedule by the patients themselves. So e-health is a piece of important component in Hong Kong's path to become a smart city. Now, in terms of supporting sharing of data, facilitation of self-health management, and development of primary health care, I have several suggestions. First of all, the Secretary will be empowered to require specified healthcare professionals to provide specified healthcare data into the account of the healthcare recipients to make the record more comprehensive, so that the healthcare recipients can receive more timely care and also avoid duplicating treatments and diagnosis. Now, there are some 4.5 billion healthcare records on the system, but 99% have been provided by the public healthcare providers. Now, that would result in an incomplete healthcare record of the patient. Every time when the patient sees a new doctor, they have to convey the situation to the doctor again. It would delay their treatment. Now, according to the bill, concerning whether there would be a retrospective effect on the provision of healthcare data, the government will prescribe for that through subsidiary legislation. I know that it will involve additional manpower input and technology setup. Now, some private healthcare institutions are hesitant to share the healthcare data because they are worried that this may hurt their business. So I hope the government will take more appropriate measures to ensure that private healthcare institutions, especially the larger institution, to consider to prioritize health patients' interests and share the healthcare data. And also, I support the government for expanding the scope of healthcare professionals to have access to healthcare data. Now, there are 13 types of healthcare professionals who are able to access the e-health records. The government will extend the scope to speech therapists and also other professionals, for example, clinical psychologists and occupational therapists. Now, the 4 kinds of special allied healthcare professionals, including speech therapists and audiologists and so on, will be able to have access to the e-health as well. This will allow the allied health professionals to understand the needs of patients better. I applaud the government for prioritizing the welfare of patients. Now, since the e-health is a system with a lot of personal data, there is a need to protect the system's integrity and cybersecurity. Over the past few years, there were several government departments subject to cyber attack, resulting in data leakage. E-health contains 4.5 billion pieces of healthcare records and personal data. It is so fortunate that no incident has happened. However, since cyber attack has become more rampant, we have to build a strong firewall. There must be sufficient cyber attack drills and also emergency plans to ensure that the data is absolutely secured. I so submit. Reverend Peter Kuhn. President, the e-health system was launched in 2016. The development progress has been rather slow. There are some 6.1 million registrants covering 80% of our population. However, 90% of the healthcare records have been provided by the public healthcare system. In other words, a lot of private healthcare stakeholders, for example, clinics and private hospitals, have not enrolled in the scheme actively. Now, in face of the aging population, there are many benefits to expand the health scope. I've been thinking the reason why so many people are reluctant to share their personal data or healthcare data onto e-health. It may be due to misunderstanding. Some worry that the information would be made accessible by strangers. And also, they are not sure about the benefits of sharing the healthcare data. Or I can at least think of 2. Say, if a patient is in a coma, when they are sent to the A&ED, they cannot relate their situation to the healthcare providers. Now, with e-health, the lives can be saved. If they have drug allergies and if they are on certain drugs, the doctors will know. Otherwise, there may be misdiagnosis and wrong prescription of drugs. I'm so pleased that we haven't seen any incidents of healthcare data being leaked. Most doctors in the past would use a notepad for health record. But if the record is lost, I don't think any doctor would remember the details. So I think we have been worrying too much about privacy in the past, and some doctors in the trade are eager to protect their craft. That's why they were hesitant in sharing the data. Now, I think the government's job is to convince the public that there are more pros than cons. Just take the examples I have given, especially when our lives are in danger. In the ANED, when we aren't able to talk, our family members may not know what drugs we are taking, especially for elderly people. So I think the government should enhance publicity to reassure the public. Now, in the future, the trend will be harnessing the power of digital technology and data analysis. In terms of e-health, with better health record, we can better predict healthcare needs in Hong Kong and allocate our resources and strategy more accurately. That can enhance the efficiency of our healthcare system and the quality as well. The passage of this bill will mark a milestone into Hong Kong's transition into a smart healthcare city. So I hope that with the bill we can ensure the sustainable development of the e-health.
我發言係表示支持。
Professor Chen Wenkong. Thank you, President. I speak in support of the Electronic Health Record Sharing System Amendment Bill 2025. The bill, in short, the bill will not only provide a legal basis for the sustainable development of e-health, but complements the government policies on cross-boundary medical services. The bill will upgrade the functions of e-health so that we can create a comprehensive healthcare data for the members of the public and provide a more efficient and quality information for HCPs. I'd like to speak on the clauses that I'm most concerned. Speaking of e-health, I have to talk about the access of Chinese medicine practitioners to e-health. Currently, 13 specified allied healthcare professionals can, upon obtaining sharing consent, access relevant health data of HCRs and provide their services. The bill seeks to expand the scope of allied healthcare professionals to nutritionists, clinical psychologists, chiropractors, so on and so forth. I think that by expanding the scope of practitioners that have access to the health data on e-health, they can provide more appropriate and suitable services to the members of the public so that they can receive more comprehensive service from HCPs. This benefits the members of the public, so I fully support it. But as many of you may not know, different professionals have different access rights to health data of HCRs on e-health. Currently, registered CM practitioners can only access electronic health records uploaded by other CM practitioners and information on hospitalization, visits and appointments, vaccinations uploaded by Western medicine practitioners. They cannot access other treatment, radiological and images information uploaded by other Western medicine practitioners. At the same time, WM practitioners cannot have access to records uploaded by CM practitioners. This undermines cross-professional collaboration and does not meet the needs of CM practitioners on clinical diagnosis. I think that the government should have to break and to remove this barrier, we have to expand the scope of information shareable between CM and WM practitioners on e-health so that we can have digital connection among different practitioners and improve efficiency. President, one of the focuses of the bill is to empower the Secretary for Health to require HCPs to deposit the specified health data of a HCR into their personal e-health account. I fully support it. I think that this is how we can address the issue of private HCPs not uploading health data onto e-health. But the bill only requires the HCP to deposit the specified health data of a registered HCR into their personal e-health account instead of depositing all health data. And in terms of retrospective effect of the bill, the government only ask the HCPs to upload health data of the HCR with consent upon amendment of the bills been implemented. But this has to do with the integrity of the health data of the members of the public. So I think that the government should provide support to HCPs when they come across difficulties, especially for private doctors and practitioners who are used to manually writing the health records of their patients. We have to make sure that they receive adequate support. Unless the HCR specifies that they do not consent uploading of their sensitive records onto eHealth, I hope that the HCPs will upload all health data collected before the operation of the bill so that we can create a more comprehensive electronic health records for the members of the public. President, the bill also provides a recognition of non-Hong Kong HCPs and information infrastructures. And these HCPs and information structures will have access to health data on eHealth. I think that this is how we can address the demand for cross-boundary healthcare services. However, health records is personal data. The government must play the gatekeeping role and devise measures to make sure that non-Hong Kong HCPs can correctly access health data of the members of the public to protect the health data of the people. At the same time, I think that the government should explain clearly the measures by clarifying that non-Hong Kong HCPs can only have access to health data of the members of the public with their consent. Under other circumstances, healthcare data of the regular members of the public will not be able to be sent to non-Hong Kong HCPs. Lastly, although there are already 6.1 million registrants with eHealth, as I said in the Bills Committee meeting, many members of the public only registered as the eHealth users because of COVID, because the government upload their vaccination records onto the eHealth at that time. Many people don't really know what it means by sharing consent, and many of them don't remember if they have an eHealth account. The administration said that the active users of eHealth mobile application amount to only 1 million people. In other words, 5 out of 6 registrants do not use eHealth on a regular basis. This is not in line with our policy intent, so I think that the government should step up publicity and promotion so that people will make use of eHealth to manage their health records actively. I support the bill and the amendments proposed by the government. Mr. Yang Winkett. Thank you, President. Last year, the Finance Committee approved $1.4 billion on the development of eHealth Plus. This is how we integrate the healthcare data sharing, service delivery, and care journey management. I'm glad that through the bill we can upgrade the functions of the eHealth and promote cross-boundary use of it. We can connect the public and private healthcare practitioners' data, and we can require HCPs to upload health data of people onto eHealth so that we can create a comprehensive healthcare information infrastructure. There are about 6.1 million registrants of the eHealth that account for 80% of the population. 1 million are active users. Many children have not become users or registrants of eHealth. I wonder if the government will consider tying the newborn baby bonus to the registration of eHealth or impose a opt-out mechanism. That is, we should require babies to register on eHealth from birth unless their parents decide otherwise. We should encourage members of the public to upload their health data onto eHealth Plus. And at the antechamber exchange, I suggest the secretary to include health data, blood pressure, sleep quality, and information as such onto the eHealth Plus. And we can work with health watches so that members of the public will be more incentivized to register an account with eHealth. At the first stage, we should target babies, toddlers, teenagers, and we should also work with primary and secondary schools to promote eHealth Plus so that they develop a habit of using it from a young age and turn it into a mobile application to monitor their health. We have new functions on eHealth Plus, such as health management. By this, eHealth Plus will become a mobile application to manage health. At the same time, the government is encouraging private HCPs to upload health data onto eHealth. For clinics that are less digitally prepared, they make their records manually. It is difficult for them to digitalize the health data of their patients of a decade. The government has been engaging a third party to promote digitalization of these records among private HCPs. Many pilot schemes have also been implemented to promote interfacing of different systems. We should also amend ordinance in the future to mandate all HCPs to upload information such as allergy history, vaccination records, prescriptions, diagnosis, images onto eHealth. I support these measures because this is how we consolidate health records of the people and enhance the accuracy of diagnosis. This will also lower the cost of repeated treatment or radiology. If there are less HCPs uploading health data on eHealth as expected, we should mandate them in doing so that we can give full play to the functions of eHealth. Some patients don't want to have their sensitive health records uploaded onto eHealth. As a result, in the new eHealth application, HCPs can explain why they don't upload some health data onto eHealth. Say, for example, if they've received a notice by the XDR saying that they don't want to upload their health data onto the eHealth, then the doctors can have a defense. For insurance companies, if they want to make use of any information coming from the eHealth, they have to obtain direct authorization or consent from XCRs or XCPs. On the cross-boundary application of HCP of eHealth, we have to protect private data privacy of the people. Before the non-Hong Kong HCPs have access to health records, they have to have consent from the XCRs. I'm also concerned about the functions of eHealth Plus and HA Go. The reservation functions of these two applications are similar. I've been asking the government to integrate these two applications so that people don't have to download the applications separately. This will save cost for the government. I hope that the government will consider it. I so submit and support the Electronic Health Record Sharing System Amendment Bill 2025 and the proposed amendments by the government.
Mr. So Chung-wing. Mr. Deputy, there has been rapid technological advancement. At the same time, there is an increasing demand for healthcare services. We need to make use of reform to improve our healthcare services. We need to make use of technical platforms. The current e-health sharing system has provided a good platform for sharing, but there are inadequacies, say, for example, limited scope of data sharing. as well as a restricted scope. This amendment exercise upgrades e-health as the centralized system. It will be called the Electronic Health Record System. There are additional services such as multiple sharing of data, service delivery, and care journey management. In addition, there are functions that facilitate cross-boundary sharing of record, which is conducive to the provision of quality healthcare service. It injects vitality into the system. There are also a number of innovative breakthroughs. Say, for example, streamlining of the consent mechanism as well as the use of electronic medical documents. The Secretary for Health is empowered to give instructions for information to be deposited into e-health. This lays a good foundation for comprehensive data sharing. In relation to non-Hong Kong healthcare providers and non-Hong Kong information infrastructures, there will be a recognition mechanism in place. This is not just an upgrade of technical ability. This is, in fact, a reform. It helps to improve healthcare service quality. A full set of data will provide comprehensive information for doctors, which improves the accuracy of diagnosis and the effectiveness of treatment. At the same time, the cost will be driven down. Data sharing will prevent repetitive or duplicated treatment or diagnosis. It improves the overall efficiency of the healthcare system. The bill also promotes innovation and improvement. The data collected will be conducive to the development of our healthcare system. While bringing huge benefits, I do think that there is still room for improvement. For example, in terms of small healthcare practices, it will be difficult for them to handle a large volume of data. There are still a large number of doctors who record healthcare records manually on paper. The administration said that when the time is right, they will require the healthcare data to be uploaded. Clinics that use paper form records may encounter difficulties. It may also cause problems to the integrity of information. The government said that a third party may be engaged, but it incurs cost. Will the government provide support so that clinics don't have to shift the cost onto patients? Under the bill, for the first time, non-Hong Kong healthcare providers will be allowed to access records on e-health. But there are a lot of hurdles to be tackled. Say, for example, the information obtained may be shared forward. These non-Hong Kong healthcare providers are not regulated by Hong Kong. It's difficult to ensure privacy protection. My suggestion is that the government talk to mainland counterparts to ensure that there is data privacy protection and that there will not be any data leak. Technology advances. healthcare service should improve as well. The e-health can be developed into citizens' smart ID in a way that it will be a centralized platform that handles all healthcare information of the recipient. Different service providers will be connected. This approach will address a lot of problems. I suggest that there is room set aside for future development so that new functions can be accommodated. Say, for example, teleconsultation. I speak in support of the Electronic Health Record Sharing System Amendment Bill 2025. I also support the third reading and the passage of the bill. Mr. Ma Fong Kwok. Mr. Deputy, I speak in support of the Electronic Health Record Sharing System Amendment Bill 2025 as well as the various amendments. In particular, I support the establishment of the legal framework empowering the Secretary for Health to require specified healthcare providers to provide specified health data into e-health. I also support the recognition of non-Hong Kong healthcare providers and public health record systems for access of information in e-health. In short, it means that healthcare practitioners and their team must upload information onto e-health. The second part is to tie in with the prevalence of cross-boundary healthcare services. A lot of people are like me. I go to see a family doctor for ailments and specialists for major diseases. We heavily rely on the public sector. We have at least 5 to 6 accounts with different healthcare providers. Before the Electronic Health Record Sharing System was enacted 10 years ago, patients will have to go through all the diagnosis and treatment if they go to a different healthcare provider or if they simply switch from private to public or vice versa. This is an additional burden and harm. Say, for example, you will have to ingest imaging agents into your body. You might have to go through MRIs. But of course, when it comes to sharing of information, there may be some vested interests at stake. The sharing system was finally put in place only 10 years ago. But we have seen proof that the sharing system is effective and beneficial. According to a survey, there are about 58,000 healthcare providers registered in e-health. For doctors, it's 85%, about 13,200. The number is lower for Chinese medicine doctors, 9%, less than 1,000 doctors. However, under the original framework, there is no requirement that patients' information has to be uploaded. Majority of private practitioners have joined the e-health, and they have access to information with consent given. However, only a handful of them will deposit data into the system. That's why, under the bill, the Secretary is empowered to require specified healthcare providers to provide specified health data into the personal accounts of registered recipients. In this regard, I support the proposal. There are lots of conditions that require continuous care and treatment. It is only natural to go to seek second opinion. The sharing of data will be conducive for the patient to receive the best treatment. When a patient has seen the doctor, paid for the service, the record should belong to the patient. They have the right to know. As long as there is consent to upload information, doctors have no reason to refuse. When it comes to additional workload, we have AI. AI can do the work of uploading for doctors. The accuracy is quite high as well. So when it comes to the proposal to streamline the consent mechanism, especially those that are minor, especially and setting out clear duties and obligations of practitioners, it is a very constructive proposal. As we all know that a lot of Hong Kong people use the Hong Kong U Hospital in Shenzhen, there are also a lot of Hong Kong residents seeking medical consultation on the mainland, from endoscopy to surgery of a replacement of kneecap. In addition to the low cost, there is also the short waiting time. These are advantages of services on the mainland. If there is data sharing, if healthcare providers on the mainland can access the information, patients will benefit. This will facilitate access to information and prevents duplication of treatment. All these proposals are there to provide better support of healthcare data sharing. Our life expectancy is longer. There will be an increasing demand for healthcare. If we do not take care of our elderly, the burden on our healthcare sector is huge. If better quality is provided, especially in terms of care, the pressure will be alleviated. According to an ancient literature, for high-quality doctors, they adopt a preventative approach, whereas inferior doctors will only address the symptoms. We think that better healthcare management will improve the alertness of the members of the public. We have to adopt a preventative approach. I speak in support of the second and third reading of the bill.
Ms. Eunice Yung, Deputy President, I speak in support of the Electronic Health Record Sharing System Amendments Bill 2025. Society is progressing at a fast pace. The demand for healthcare services are not just limited to reliability and timeliness. Patients also care whether the data can be shared across different platforms. They're also concerned about personal privacy. The bill has responded to all these aspirations. After the amendment, with a joining consent, sharing consent will also be deemed to have given to enable healthcare providers to upload healthcare data, so that in future, the patients will no longer have to bring along their health record when they consult another doctor. That will make the care journey more hassle-free. It is more convenient for elderly people and patients with chronic diseases who have to cross districts to receive treatment. It also echoes the trend of data sharing. eHealth will no longer be just a data sharing platform, but become an actual piece of healthcare infrastructure. Now, the specified healthcare providers will have to upload shareable data, including allergies and adverse drug reactions, diagnosis, radiologist reports, and so on, to make sure that the healthcare record of each patient is complete. This will have a key role to play in formulation of healthcare policies. Now, this bill will encourage collaboration between Hong Kong and other cities in the GBA. With more and more people retiring in the Bay Area, there is more genuine need for healthcare data sharing. Now, the bill will allow recognized non-Hong Kong healthcare providers to have access to e-health data with patients' consent. It will ensure real-time data sharing and also data security. This will eliminate the risk arising from the gap between healthcare data of the two places. It will also reassure the patients receiving treatment across the border. Now, the healthcare providers can only access the data on a need-to-know basis, and there are also safeguards in relation to personal data privacy. This has laid a sound foundation for further collaboration on healthcare in the GBA. The bill has also responded to the innovative trend of global healthcare industry. There is legal support and technological support for telemedicine. Since the pandemic, telemedicine has become a part of our life. Now, the bill also facilitates the circulation of electronic health documents. Through the platform, patients can receive prescription, healthcare records, and diagnosis reports through the system. This will enhance the security of cross-boundary and cross-sectoral healthcare collaboration. Now, for elderly patients requiring multidisciplinary care and also patients across the border, they can have unlimited access to their healthcare data with full support. This marks an important step in Hong Kong's transitioning into a smart city. But there are also many bottlenecks in promoting e-health. First of all, the digital readiness in the private healthcare sector varies. Some small practice clinics, because of the lack of resources, cannot link up with the e-health immediately. But I understand the administration has been approaching different clinics to promote the benefits of e-health and provide help for them to upgrade their system for connectivity with e-health. Now, many patients did not register in e-health because they are not aware, but they do not understand the process. There are also data kept by chiropractors and Chinese medicine practitioners which are not shared on e-health. So the government must reach out more to other specified healthcare providers. The bill has offered improvements on bottlenecks, for example, streamlining the consent mechanism, expanding the scope of professionals with access to e-health data, and also providing better support for the private sector to embrace e-health, and also an enforcement and regulatory mechanism. Now, this is a long process. There are still a lot of work to be done. The government must continue to provide help to private practices, especially those with fewer resources. We have to help them to enhance their digital readiness to connect with e-health. Public education is also important. The public must be encouraged and reassured to boost the onboarding rates. Now, concerning data security, with wider connections with more institutions and even across the border, data security is important. The government and the health and the hospital authority must devote more resources to technological solutions, including biometrics, encryption, and other cybersecurity measures to prevent cyber attacks and ensure confidence. Ms. Carmen Khan. Deputy President, I speak in support of the Amendment Bill 2025. The EHRSS CAP 625 was introduced in 2016. It provides for a legal framework for the operation of e-health. This bill seeks to amend CAP 625 by enhancing the collection, sharing, and usage and protection of data on e-health. We can align with the 5-year development plan for eHealth Plus announced in the policy address. Support is given to healthcare reform. As a member of the Bills Committee, these are my views. First of all, establishing a comprehensive, personal, electronic health record account. This is very important. even with the passage of the bill, it is still voluntary to register on eHealth. Now, I think we should start with newborn babies. Registration under eHealth should be made default for registration of newborn babies unless the parents opt out from the registration. Then from then on, the patients will not have to bring along paper-based record. Now, according to report number 80 of the public accounts of the Director of Audit, there has been an investigation on the underwhelming onboarding rates of eHealth and also digitalization. Some recommendations have been made. If we can start popularizing the use of electronic health records starting from infancy, that would be beneficial. Now, in terms of provision and access to health data, according to the administration, as of February 2025, private healthcare providers only provide for a very small portion of the data to eHealth, despite having access to 60% of the data. Among the 4.5 billion healthcare records on eHealth, only less than 1% has been provided by private healthcare providers. So many private doctors are only reading the record without providing healthcare data in return. Now, under the consent mechanism, the existing consent mechanism, private healthcare providers may not upload the private healthcare data onto eHealth after making a diagnosis. Now, the healthcare data is owned by the patient, but sometimes they are not uploaded onto eHealth. So I welcome one of the amendments in the bill, that is streamlining the consent mechanism. Once a joining consent has been given, all healthcare providers may provide the shareable data onto the eHealth account of the patient. I hope the government will make use of interesting ways to educate the public on how the consent mechanism works. Information packages should be prepared to help patients understand how eHealth can protect their health. Also, we should educate the private doctors on how to better protect the healthcare data of patients. Now, under 26Q, Section 26Q of the bill, the Secretary can direct healthcare providers to provide specified healthcare data into eHealth. The scope will be specified under Schedule 3 by way of subsidiary legislation. Now, in the second half of the 5-year development plan, that is 2027, when the technological readiness is ready, the government will exercise this power. I welcome this arrangement. It will ensure the specified healthcare providers to bear the responsibility to provide specified healthcare data so that the patients can have control over important health data. Second, the bill will enhance the primary healthcare concept. Now, under the leadership of the Secretary, there is a multidisciplinary team of professionals providing primary health care. Now, in the bill passed last week, referrals can be made without a medical doctor's recommendation to allied health professionals. Now, I applaud the bill for extending the scope of eHealth professionals. There are 5 types of professionals under the accredited registered scheme for healthcare professions. They include speech therapists, audiologists, dietitians, educational psychologists, and clinical psychologists who will have access to e-health data. In provision of primary health care services, they can provide continuous care for the patients with the help of data on e-health. Now, in terms of facilitating patients' choice of healthcare providers, I suggest the government establish a quality assurance system. That is, we should incentivize more private healthcare providers to join e-health. Now, there should be various levels of recognition. With a more comprehensive set of data, the recognition level would be higher. With this arrangement, we can make use of the market's force to incentivize more healthcare providers to share healthcare data, because this will give them more recognition and, in turn, more business. Now, this should go the other way as well. Now, under the chronic disease co-care scheme, patients are required to join e-health before they can sign up for the program. So we should extend this arrangement to other government-run healthcare programs as well. Now, cross-boundary data sharing is also important. Part 6 and 7 in the bill empowers the Commissioner for Electronic Health Record to offer recognition to non-Hong Kong healthcare providers and non-Hong Kong information infrastructure if they are satisfied that certain conditions are met. This can support cross-boundary healthcare needs. Many members, including myself, have raised concerns over the security of data and protection of personal privacy when cross-boundary sharing of data is involved. Now, there is a safeguard in the bill that if the Commissioner considers that the recognition of a non-Hong Kong healthcare providers would jeopardize the integrity of the system, the recognition may be suspended and measures can be taken to strip the healthcare providers from access to e-health. And during that period, no new data can be provided to the e-health system by the healthcare provider. This will enhance the recognition and the security of data of e-health, and I welcome this. Now, finally, the bill proposes to add clause at section 30B. It specifies that any specified professionals may use identifiable data on e-health to roll out government-recognized healthcare programs. And under 30C, non-identifiable data may be used for policy setting. I welcome this arrangement. This is actually important. We have to make good use of healthcare data to expedite Hong Kong's progress to establish the primary evaluation system so that we can encourage the development of drugs locally. I thank the Secretary for leading the team to introduce many pieces of important legislations into LegCo. I hope the bill will be passed. Thank you.
Mr. Kenneth Leung. Thank you, Madam Deputy. As we promote smart city and smart government, we have to digitalize our health record system. Chinese medicine authorities of our country promulgated the 14th Five healthcare plan. States that by 2025, our country will build a consistent and comprehensive healthcare information infrastructure. I'm glad that the government in 2023 policy address launched the 5-year development plan for eHealth Plus. This electronic health record sharing system amendment bill 2025 spans across different areas, from the collection and storage of health data to obtaining of such data. If HCPs can have access to comprehensive health data, then this is a milestone for our healthcare reform. As a member of the Bills Committee, I speak in support of the bill. I think that upon passage of the bill, we will make better use of our medical resources, and this is how we strike a balance in the healthcare ecosystem. I fully support the proposal set out in the bill, but in terms of its details, in terms of publicity and promotion, as well as to how we can promote a sharing of health data, I think that the government can improve the relevant details so that HCPs and HCR can make better use of the resources available and enhance enforcement efficiency. Madam Deputy, during the scrutiny of the bill in the Bills Committee, many members asked the government to step up publicity and promotion of the bill. At the meeting, I also asked about the number of registrants for e-health. The government said that 80,000 people, especially young people and minors, have not registered an account with the e-health. Many of them don't know how to register for e-health or what functions are available. That's why the age distribution of e-health users form an inverted pyramid shape. I think that the government should explain to members of the public very clearly the functions and benefits of e-health so that the people know how it works. Over the long run, I think that the government should streamline the registration procedures for newborn and minors so that they have a more comprehensive set of health data. We should also encourage the 80,000 people who have not registered to do so that it will not become a legal blind spot. I think that the government should also amend access to specified health data by private HCPs. By amending this bill, we want to encourage private HCPs to upload health data onto eHealth. The administration said that the access rate of eHealth of private HCP is higher than the upload rate. So I think that the administration should require some private HCPs to upload health data onto eHealth. Some clinics, especially small practice clinics, come across difficulties in using eHealth. Their computer system may not be compatible with eHealth, and some HCPs do not know how to upload health data onto the platform. Many senior and aged doctors are used to handwriting the health records of their patients. They may not know how to do so digitally. So I think that the government should set aside resources to provide technical and financial support to private HCPs so that they can connect their systems to eHealth. Madam Deputy, as more and more people receive treatment and diagnosis on the mainland, we are providing for a legal framework for non-Hong Kong HCPs to have access to eHealth. Non-Hong Kong HCPs can access the health records of the patients, and they can also upload their health data onto eHealth. And this is how we make cross-boundary healthcare services more convenient for the members of the public. Although there are multiple control and requirements in place to guard against misuse of data, I think that the government should improve the existing rules and regulations to minimize a risk of leakage of personal data. So I think that the government should consider working with the mainland authorities and healthcare institutions by formulating scope of responsibilities, rules and regulations, and devise a detailed sharing arrangement. I so submit. I support the bill. Thank you. Mr. Champulan. Thank you, Madam Deputy. To dovetail with the e-health development plan and to better support e-health healthcare reform, I support the Electronic Health Record Sharing System Amendment Bill 2025. Health data will become more comprehensive if they're uploaded onto eHealth, and that will facilitate decision-making of HCP. Since the commissioning of eHealth in 2016, 6.1 million people have registered, accounting for 80% of our population. However, among the 4.5 billion records, only 0.3% are uploaded by private healthcare institutions. The participation rate of private HCP is rather low. Many people think that health records of their patients are their assets. They're not willing to share it. The lack of sharing of health data undermine the development of our comprehensive health care system, and that undermine the clinical diagnosis and treatment. The bill seeks to build a comprehensive healthcare information infrastructure for the members of the public, streamline the consent mechanism, and empower the Secretary for Health to, with the consent of the members of the public, require specified HCP to deposit specified health data into their personal e-health account. The government, in order to promote private-public partnership, should encourage and assist private HCPs in uploading the health records of their patients onto eHealth. The pilot scheme on eHealth has been very successful. I think that the government should continue to work with private healthcare institutions to improve their systems so that we can assist private institutions that are less digitally ready. The administration at the Bills Committee meeting said that there are still 20% of private doctors that have not made use of any form of electronic system. We have to help them transform, and we have to help them connect their systems with the electronic health record system. Another focus of the bill is to empower the EHRC to recognize non-Hong Kong HCPs and information infrastructure when certain requirements are met, so that these practitioners and infrastructures can have access to health data on eHealth. I think that this is how we can promote sharing of health data as we protect data privacy of the people. Many people are now retiring on the mainland. The healthcare vouchers can be used there. If non-Hong Kong HCPs can have access to health data on eHealth, then we can make better use of the resources and promote integration of healthcare services on the mainland and Hong Kong. When Hong Kong patients receive services on the mainland, then the eHealth will send the health data of the relevant patients to the relevant non-Hong Kong HCPs or information infrastructures. This is how we can promote cross-boundary collaboration and sharing of healthcare data. Although we don't have a list of recognized non-Hong Kong HCP or infrastructure yet, we only have a framework. I think that the government should use the 9 service points in the 9 cities in the Greater Bay Area where the healthcare vouchers are piloted. I think that the government should promote integration of systems in Hong Kong and mainland. When there is data leakage incidents happen at Hong Kong HCPs, we have to divide measures against that. Thank you.
Mr. Tommy John. Madam Deputy, the Liberal Party supports the passage of the bill. In 2015, the LegCo passed the Electronic Health Record Sharing System Ordinance. In 2016, the administration launched the e-health record sharing system to enable data sharing, uploading, and access of health data of recipients. It's been 10 years. According to information provided by the administration, as at the end of February, there are about 6.1 million people registered in e-health. There are about 3,700 healthcare institutions participating in the scheme. The download rate of the mobile app is 3.7 million. The record itself is good. However, the actual implementation speaks a different story. There are about 4.5 billion shareable entries. 99% of the entries are in the hands of the hospital authority and the Department of Health because they uploaded the information. The amount comes from the private sector, accounts for less than 1% of the total amount, which is negligible. When it comes to access, 60% of the access come from private healthcare providers. The figures speaks the truth. Practitioners in the private sector actively use the information on e-health in their course of business. Under the current legislative approach, even with a consent given, the doctor in the private sector can choose whether to upload the information on to e-health. These cold figures shows us that less than 1% of the uploading rate means that majority of doctors in the private sector are not too enthusiastic when it comes to uploading information onto the system. Perhaps they think that the uploading will add to the workload and operating cost of their clinics. It's almost 10 years since the launch of the sharing system. The uploading rate from the private sector remains low. Obviously, it's nothing to do with operating cost. Medical records of patients is an important resource to private practitioners. They don't want to share the valuable information to other practitioners. I think it's more important to them than the patients. The low upload rate from the private sector is a major obstacle to access to quality service by patients. The inaction of the private sector is another hurdle. In 2023, the policy address states that there will be the eHealth Plus. That means the sharing system will be upgraded into a comprehensive healthcare information infrastructure that integrates data sharing, service delivery, and care journey management. It provides a personalized service. If we are to achieve the goals of E plus health, we will first have to tackle the inaction of practitioners in the private sector. The prime objective of the bill is to require specified healthcare providers to provide specified health data into the personal accounts of recipients. This addresses directly the inaction of practitioners in the private sector. There is a lot of implementation details. Say, for example, the streamlining of the consent mechanism, which makes it easier for healthcare providers to access information. There is also the establishment of a legal framework for the use of electronic records in the system. Non-Hong Kong healthcare providers and information infrastructure will be recognized so that residents in Hong Kong can access their information across the border. All these gives more control of recipients to manage their record. Everyone will be given the choice to manage their healthcare data. The general public will have access to their own medical information. They will not be at the mercy of individual practitioners. In addition, the construction of a comprehensive information infrastructure will help the improvement of our healthcare system. Last week, we saw the passage of the Supplementary Healthcare Professions Amendment Bill 2025. Now, we have the Electronic Health Record Sharing System Amendment Bill 2025. Both of these bills mark an important step towards our healthcare reform. I speak in support of the bill. Mr. Chen Kim-po. Thank you, Madam Deputy. I speak in support of the Electronic Health Record Sharing System Amendment Bill 2025. The bill provides a legal framework for further development of eHealth Plus. It is a comprehensive healthcare information infrastructure that integrates multiple functions. It also is conducive to the development of primary healthcare. There will be a comprehensive platform to manage imaging, information, personal information, allergies, and other essential information. This will be a lifelong healthcare record which improves efficiency. It also reduces the risk of dispensing of the wrong medication. It improves the efficiency of treatment. There is the streamlining of a consent mechanism. You only have to give adjoining consent for the information you only have to give a sharing consent for the information to be shared. The uploading of information will be easier. This is beneficial for patients to manage their healthcare record. The scope of access will be expanded to specified allied professionals, including psychologists, clinical psychologists, audio technicians, etc. So they will play a bigger role in the provision of healthcare service. Of course, there are issues relating to privacy concern, but there are safeguards making use of biometric data, AI, high-quality cloud service. There are also a number of functions to reduce risk. When there is connection with non-Hong Kong healthcare providers and infrastructure, there will be stringent requirements. When there are risks, the connection will be cut. In relation to data leak, these non-Hong Kong providers will have to meet the conditions and requirements set down by the Commissioner. They can only access information relating to the consultation with consent. We have over 6.1 million registered account holders, covering 60% of the population. The improved platform will promote healthcare reform. Through the development of primary healthcare, the efficiency of healthcare will be improved. It is also conducive to cross-boundary service provision. I so submit.
Ms. Nixie Lam. Thank you, Deputy President. I speak in support of the Electronic Health Record Sharing System Amendment Bill 2025. Hong Kong's healthcare system has always been one combining public and private services. However, the lack of sharing of data between the two segments has deprived patients of a comprehensive health record. Now, the e-health has covered 80% of our population. It shows that there is huge demand for e-health from the patients. But with the technological advancements, the e-health is beginning to show its deficiencies. Private healthcare institutions only contribute 1% of healthcare data, and also there is no clear standing of e-documents issued through e-health. Now, with the bill, e-health is not just a data sharing platform, but a comprehensive piece of information infrastructure. Now, under the bill, the consent mechanism will be streamlined. Only joining consent is needed for sharing of data, and also the patients can maintain control over the data. And also, the bill provides for a recognition arrangement for non-local healthcare providers. This will encourage cross-boundary collaboration in healthcare and ensure seamless sharing of data across the border. Also, the bill provides for the legal status of healthcare documents issued through the system, for example, sick leave certificates and so on. Now, the new authorization function of the bill allow patients to designate a family member to manage the e-health accounts for them. This is beneficial for elderly and chronic patients. There are also offenses in relation to holding out or purporting to be e-health or misuse of the name of e-health. Now, I think we have to go further than enhancing the sharing of healthcare data. E-health data is not just a piece of convenience tool. It is actually the foundation for medical innovation. So on the premises of protection of personal privacy, we should use anonymized data to support healthcare surveillance and also research and development of innovative healthcare. Now, the underwhelming participation rate of private healthcare sector has to be rectified through policy directions, for example, financial incentives, and also more programs to encourage more healthcare providers to join the network. Cross-boundary healthcare is an important segment in our healthcare system. There is more and more demand for cross-boundary healthcare services. So we need to establish a cross-border healthcare data standard. With security protocols, we can establish confidence in cross-boundary sharing of data. This will establish safeguards for patients receiving care across the border and also establish our position as an innovation hub. Now, we should nurture a more comprehensive and more interdependable healthcare ecosystem so as to support the medical innovation in Hong Kong. I support the bill. Mr. Edmund Wong, Deputy President, the bill requires all specified healthcare professionals to upload patients' healthcare records to e-health if consent is given by the patient. This has enhanced the mechanism of data provision to e-health, as well as expanding the scope of access to e-health to more professionals under the accredited registered scheme of all healthcare professions. This will also facilitate the use of electronic medical documents through e-health, as well as recognition system for non-Hong Kong healthcare providers. Now, this bill has enhanced the e-health system and make possible sharing of healthcare data with healthcare providers in other places. This is an important step. In his 2023 policy address, the chief executive proposed the vision of eHealth Plus, which span across the entire care journey and different ecosystems. This bill will promote mutual beneficial collaboration across various disciplines. This will enhance the quality of services provided to patients and also supports the development of cross-sectoral and cross-departmental healthcare policies. Now, this bill will remove the barriers between different healthcare providers. With sharing of data, a more comprehensive care plan can be formulated for patients. But this transparent mechanism may impose pressure on some patients. As an international financial center, many people are faced with huge stress. Many people in Hong Kong have emotional needs requiring psychological support. Among them are public figures and famous artists. Government officials or public figures are hesitant to share their conditions because of their public image, so they would rather go to overseas places to receive treatment. I'm not commenting on the right or wrong of this choice, but this really offers more privacy to patients. Now, with full connectivity between our healthcare record system with the private sector, or even the hospitals in the mainland, it may make these patients even more vulnerable. So I support the measure in the bill that with disagreement notice given, patients can forbid healthcare providers from sharing sensitive healthcare data with other systems. So this is a balance struck between transparency and protection of personal data and privacy. This is a sensitive approach. So I hope the government can complete the development of the e-health system to cater for the need of healthcare providers opting out from sharing the healthcare data based on disagreements from the patient. Now, we should also step up education for healthcare providers so that sensitive and embarrassing healthcare data will not be shared on e-health. We must step up on the work of protection of personal privacy so that there will be no leakage of patients' data by careless healthcare providers. I so submit.
多謝主席。
Ms. Chan Haiyan. Thank you, Madam Deputy. The healthcare system has been faced with multiple challenges. This term of the government said that we're going to deepen healthcare reform to connect private and public healthcare systems and promote cross-disciplinary collaboration. I think that with the electronic health record sharing system that spans across different strata and disciplines will be conducive to achieving this goal. Under the 5-year development plan for eHealth Plus, we are to devise a clear legal framework so that patients, when they receive follow-up consultations on public hospitals, private clinics, or get drugs from community pharmacies, they can upload their data onto the eHealth to receive better service. I support this direction. However, I'd like to raise a few points. First, on cross-boundary health data. There's been growing demand for cross-boundary medical services, but currently, their health data cannot be shared to non-Hong Kong healthcare practitioners. The government rolled out a pilot scheme on the use of elderly healthcare vouchers in the Greater Bay Area, where patients are allowed to bring their health data to the mainland. However, mainland HCPs are not able to access the health data of patients on eHealth, or can they upload the health data of the patients onto the platform. The bill will give recognition to non-Hong Kong healthcare providers and non-Hong Kong information infrastructures so that they can have access to health data on eHealth. During the scrutiny of the bill, the Bills Committee are concerned about the security issues of the systems and the fact that the law enforcement agencies in Hong Kong cannot take enforcement action on the mainland. The administration said that they're going to propose amendments to further empower the EHRC so that they can restrict the access of shareable data of eHealth by non-Hong Kong HCPs that have security risk. The bill will take effect upon passage in December this year. I think that the government should now look into which HCPs can be recognized so that we can further promote sharing of health data across boundary. The government should also devise a timetable to cover institutions that are covered by the healthcare vouchers and elderly care homes. The government should also roll out more facilitation measures to encourage people to retire on the mainland and receive medical services there. On the connection of healthcare systems in Hong Kong, the Secretary for Health will be empowered to require specified HCPs to deposit the specified health data of a recognized XCR into their personal eHealth account. The specified data may include drugs, diagnosis, so on and so forth, so that when patients receive services in private and public HCPs, they can have a more comprehensive grasp of their health data. However, some private doctors and private healthcare practitioners said that they have some worries regarding the objectives, the operational details of the bills. They have questions. Say, for example, they're worried if the computer systems of their clinic can be connected to eHealth and if they will have to shoulder further administrative burden if they are to upload health data onto eHealth. They are worried that some patients will ask the doctors not to upload their data onto the platform. I know that the government have been talking to third-party organizations to develop an interface on the platform for private doctors. The government said that they will only consider exercising the power of requiring HCPs to upload data monetarily by 2027. I think that the government should explain the details of the bill to the private healthcare providers such that they understand the benefits that will be brought to the private healthcare sector. I believe that the industry will be willing to cooperate. The bill only sets out a legal framework. More importantly, we need to have infrastructures and measures in place. Otherwise, the members of the public and private HCPs may not be willing to upload health data onto their eHealth, and there could be system security risks arising, such that personal data of the members of the public will be in the hands of criminals. Singapore, UK, healthcare systems have been hacked by criminals and financial loss was resulted. The healthcare system was paralyzed as a result. Many government departments leaked personal data of the members of the public, and some of their systems were attacked. So we have to make sure that the same will not happen again. Because e-health is not just a set of servers. Hackers can have access to health data of people through the e-health platforms. There were people who attacked the systems for organ donations. We expressed our concern on this in the Bills Committee meeting. There could be potential confusion in medical data arising from HCPs intentionally registering and deregistering multiple times. If people register and deregister multiple times, then there could be duplication in health records. If such happens, the government will ban these people from registering again. Currently, the hospital authority will provide technical support. The steering committee will be working on addressing the complaints and investigating into any complaints. According to the government, there are only 6 staff members in the committee. I think that the government should plan ahead to make sure that we have sufficient manpower to ensure the system security of e-health. More importantly, we have to think from the perspectives of the people. It's best if we can have one application to have access to all healthcare services. I think that the government should develop one mobile application for all healthcare services. The waiting time for public healthcare services is long, and the stress faced by our healthcare professionals is significant. If we can promote cross-boundary medical services provision and collaboration, I think that private doctors, private healthcare professionals, different professionals should have a better understanding of the e-health for its healthy development. I have to stress that this bill only provides a legal framework. More importantly, we have to explain to people the benefits of the bill and provide technical assistance to HCP. We also have to step up communication with private doctors, healthcare practitioners, and allied health professionals to provide support to them and incentivize them to join e-health. We also have to provide training on system security so that different stakeholders can work together with the government. Only when everyone works together can we achieve our goal. I hope that members of the public will fully support the framework. I so submit. Thank you. Ms. Lam So-Wai. Thank you, Madam Deputy. I speak in support of the Electronic Health Record Sharing System Amendment Bill 2025. The e-health was commissioned in March 2016. It's all along been the focus of the government on the primary healthcare development blueprint and the policy address. Well, e-health is set to play a very important role. In 2023 policy address, the 5-year development plan for eHealth Plus was announced to turn the eHealth from a health record sharing system into a comprehensive healthcare information system that integrates multiple functions of data sharing, service delivery, and care journey management. As of last year, 80% of our population have registered for eHealth Plus so that registered HCPs can have access to their health data. As we have more and more users coupled with the amendment bill this time, we can promote a collaboration of private and public HCPs. This will not only allow patients to receive services in public and private healthcare providers and alleviate the burden of public healthcare system. Under the current system, people can join eHealth, but only very few private HCPs upload health data onto the platform voluntarily. Upon amendment to the ordinance, the Secretary for Health will be empowered to mandate specified HCPs to deposit specified health data such as a medication, diagnosis, laboratory records, of a registered XCR into their personal eHealth account so that people can check their vaccination records, images, immunization records on eHealth. They will not have to worry about losing their certificates, and this will also save time for private healthcare practitioners. This will also minimize the medical errors. On the security and the personal data of cross-boundary medical data sharing, I voiced my concern. I think that the people are concerned about the privacy of the data. Is it the case that as long as people give their sharing consent, all non-Hong Kong HCPs will have access to health data of patients? The administration explained that the health data will not be retained by relevant HCPs only when patients receive services on the mainland and give consent to non-Hong Kong HCPs to access their data can they collect and review such data. And the government will also work with mainland authorities to formulate regulations to guard against illegal access to personal health records of the people. I think that we should create a page where people can track where their health, who have access to their health data, including the positions, the institutions, and reasons for accessing the data. And if there is anyone who accesses the health records of people, they should be able to receive notifications on their mobile phones. This will boost the confidence of the people in eHealth. Now, on sharing of information across boundary, some Greater Bay Area service providers told me that they don't really understand what eHealth is. They know that we are going to have a health data sharing system, but they don't really understand about the requirements, rules, and regulations behind it. Without a guidelines in place, non-Hong Kong HCPs may be inadvertently caught by the law. I hope that the government will formulate a timetable on the formulation of code of practice. We're going from eHealth to eHealth Plus. This is a milestone for our healthcare reform. We have to make sure that the systems of the private healthcare practitioners are compatible. We have approved $1.39 billion for the development of eHealth Plus, but there is no breakdown on the capital funding as to how much will be spent on supporting the system upgrade of private HCPs. Some private doctors told me that after upgrading to eHealth Plus, the hardware may not be compatible. Some private doctors tend to write the health records of the patients out manually. Currently, we do not mandate users to register for eHealth. These are the concerns of the private doctors. Because they are used to manual recording the health records of the patients, if they are asked to upload and digitally record the data of the patients, then they may incur a heavier administrative burden. The government said that private HCPs may procure a third-party service to digitalize all physical health data. However, this may undermine the connectivity of the systems. And if we engage a third party to digitalize health records, there may be mistakes. So I think that for the 20% of small practices, clinics that are less digitally prepared, we should support them technically by offering them subsidies so that they can purchase scanners and tablets that are compatible with eHealth Plus. We can perhaps offer websites for private doctors to upload the health records of their patients. Chinese medical practitioners play also a very important role. They serve over 80,000 patients every year. The government said that they will allow Western and Chinese medicine practitioners to check data uploaded by each other. I hope that the government will expand the access of CM practitioners to eHealth to promote collaboration between CM and WM practitioners. Digitalization is a global trend. During COVID, the remote consultation conducted by U.S. Doctors go from 40% to 85%. The Ping An application provided some 80,000 consultations during the COVID. This upgrade to eHealth will bring benefits to everyone in society so that they don't have to go for repeated consultations and they will enjoy a more streamlined administrative procedures. For healthcare providers, they will have their diagnosis, will have the accuracy of their diagnosis enhanced. This will also allow us to better allocate medical resources, control medical cost inflation. These are very important to the issue of aging population that we are facing. Thank you.
Dr. David Lam. Compiling a comprehensive medical record for patients is our duty. The goal is that wherever the patient is, when there is a need to receive healthcare service, healthcare professionals will be able to get access to accurate information. Personalized medical record is the goal. Me and my friends have been using eHealth for a number of years. It doesn't really matter whether there is any legislative requirement. If the bill is passed today, I will see this as an incentive. For doctors, we fully realize the importance of comprehensive healthcare data. But we need to respect the wish of the general public. We need to win their trust and support. We need to accord priority to the needs of patients. We need to respect their privacies. When there is an instruction from patients, the information will not be uploaded. We have doctors in every corner of our communities. We have doctors on the islands and on different parts of Hong Kong. On the islands and in remote areas, the internet reception may be poor. In the urban areas, there may not be access of optical fiber, rendering the internet speed slow. For doctors or clinics who don't use computers, I think they are few and far between. But there are still doctors who use manual records. The proposal under the bill is to connect commercial management systems with eHealth. For doctors who don't use computer management systems, if the eHealth can provide a page for them to enter the information so that the information can be uploaded and for eHealth and printed for the clinic's use, that will be good. It is something that we proposed to the eHealth record office. Well, the first clinical system was connected with eHealth last year, and this year the second one was connected. The Electronic Health Records Office is working on a third system. I've been using the first system. In the past year or so, my experience is that there are hiccups. With the efforts devoted by the office and the vendor, most of the problems have been resolved, but there are still more coming. Apart from the issues from the system, we have generic ones, say for example, when the computer is down, when there is an internet connection disruption. Imagine that there are a lot of patients waiting outside when you are battling with the computer system inside. At the same time, you are in a rush to go to perform an operation. There is tremendous pressure. We need to have swift and appropriate technical support. We also need a backup system. A lot of clinics don't have dedicated technical staff. In the past 2 or 3 months, I have been talking to doctors about the bill. I've also worked with the team in the record office. We're planning our work of the next stage. We work with doctors and office to iron out the technical difficulties. There may be plenty of difficulties, but we're all very positive. The eHealth will be the data bank and the information platform for Hong Kong. It will also provide a real-time case management for practitioners. For patients, it's also a platform for them to manage their own records. I expect that the eHealth will be the co-pilot of doctors, providing the latest clinical information, assisting me in arriving at the most accurate diagnosis. I speak in support of the bill. Mr. Johnny Ng, thank you. In 2016, the government launched the territory-wide electronic health record sharing system. In 2023, the policy address announces the 5-year development plan of eHealth Plus. eHealth will be upgraded into a comprehensive healthcare information infrastructure integrating various functions. It will further develop the primary healthcare, enable cross-boundary healthcare services. The Electronic Health Record Sharing System Amendment Bill 2025 seeks to expand the sharing, collection, use, and safeguard of eHealth. It establishes a legal framework for further development in cross-boundary healthcare provision as well as healthcare reform. There is a legal framework to assist patients to manage their healthcare records. The Secretary for Health is empowered to require specified healthcare providers to deposit specified or essential health data into the system. After the passage of the bill, I hope the government will provide additional support to practitioners. There should be collaborations with various parties to improve the system so that there will be seamless connection between eHealth and their management systems. For clinics with a lower technical readiness, additional support should be supported so that help will be provided for practitioners to upload essential information. This will be conducive to the completeness of information in their personal accounts. There are more and more people going to mainland to seek medical help. I hope that the eHealth will achieve its goal to enable cross-boundary information access. However, the government should always monitor the integrity and security of the system. There should be rigorous encryption requirements put in place to ward off hackers. The recognition of non-Hong Kong healthcare providers to get connection with e-health, I think that there should be enhanced security work put in place. There should be regular updates. There should be enhanced privacy protection. The government needs to enhance collaboration with other places. They should also sign agreements with non-Hong Kong healthcare providers and system providers. There should be clear guidelines provided so that these non-Hong Kong entities will understand how the system works and put in place required safeguards. Now we have different treatment methods. There is integrated Chinese-Western collaboration. The government should listen to the views of different sectors and expand the scope of data sharing. Say, for example, access of certain information, data sharing between Chinese and Western medicine practitioners. This will improve quality and efficiency. Currently, there are 1.6 million registered users, accounting for about 80% of our population. There are about 1 million active users of the mobile app. I asked the government to step up publicity and education to encourage more people to use e-health. Perhaps a default consent system is put in place. Newborn babies, by default, are registered users unless they opt out. I speak in support of the bill. I hope the government will continuously upgrade e-health so that comprehensive information record will be set up. This will be conducive to further healthcare reform. This will also enhance journey management as well as a cross-boundary service provision.
Mr. Holden Chow. Thank you, President. I speak in support of the Electronic Health Record Sharing System Amendment Bill 2025. President, many members have explained the background of this bill. I will not labor on those points. I am a member of the Bills Committee. During the discussion of the Bills Committee, members have pointed out that after the passage of the bill, we hope that we can help small practices to upload the healthcare records onto the e-health system. We have explored issues like the so-called one-man band, that is clinic with just one doctor and one nurse. They don't have the manpower to upload all the written records onto the system. So besides providing for the legal framework, there has to be substantive support provided for these clinics. They account for a large proportion in the industry. We are not worried about large-scale medical groups. They have the resources to do it. And also, during the discussion, I remember that I have raised the point that with the technologies we have today, there is always the concern of personal record being stolen by hackers for illegal purposes. In the Bills Committee, I said that there must be an enforcement mechanism to address these concerns. Now, under the proposed enforcement mechanism, there will be a few days gap between enforcement and the leakage. Every second counts. We need to immediately stop the linkage between the problematic infrastructure and the e-health. Also, recognized non-local information system can have access to e-health. Now, I believe this is a convenient measure because many people are seeking medical help in the mainland. So after the passage of the bill, there should be swift recognition for quality healthcare providers on the mainland. In this day and age when there are a lot of residents retiring in the mainland, it will be very beneficial, I so submit. Ms. Jyoti Chen. Thank you, President. I speak in support of the bill. I am a Bills Committee member. I speak on behalf of the FTU. I support the Electronic Health Record Sharing System Amendment Bill 2025. The amendments are more than streamlining the consent mechanism. It also enhances the efficiency of our healthcare services, expanding the usage of e-health cross-boundary and benefiting residents living in the Bay Area. As of February this year, the e-health has accumulated some 4.5 billion of e-health records. 99% of them comes from the public healthcare sector. Only 0.3% comes from the private healthcare sector. It shows that we need to enhance the participation rate of the private sector on e-health. If the bill is passed, there will be stronger linkages between e-health system and other common electronic health record system. Specified healthcare providers can be required to provide the information into the system to ensure continuity of care. Now, the FTU supports the idea of materializing cross-boundary data sharing based on the consent given by patients. Now, we have urged the government to enhance the function of the personal folder. 24 hours before the consultation, an application can be made through the e-health, and a QR code will be generated to facilitate access by healthcare providers to health record. The bill will also facilitate non-local healthcare providers to upload data generated from the consultation to e-health. This will not only facilitate medical health care across the border, but also empower the patients. We urge the government to ensure that the cross-boundary transmission of health record covers every stage of the consultation process and also step up protection on data security. Now, after the passage of the bill, the two-tier consent mechanism will be streamlined so that once joining consent is given, sharing consent is also given to healthcare providers for access and provision of data. As of June this year, the onboarding number has reached 6.1 million, accounting for 80% of the population. Now, after the passage of the bill, I hope the onboarding rate will continue to rise. It will ensure portability of healthcare record and also allow healthcare providers to have accurate understanding of the patient's history. Now, in terms of developing primary healthcare, this bill is important. With cross-boundary healthcare cooperation, we can fulfill the vision in 2020 Healthy China. The vision mentioned promoting collaborated development of healthcare system in the GBA. Now, elderly people has more incentives to join e-health. However, for newborn babies, we understand that the participation rate of newborn babies in e-health is low. It may be due to lack of confidence in the system on the parents' part and lack of understanding. So newborn babies should be targeted as potential registrants. We should start from kindergarten and also the natal wards in hospital. We should educate parents about the benefits of joining e-health and promote the concepts of primary health care. This will lay a solid foundation for cross-boundary healthcare collaboration and data sharing. The future direction should premise upon the core concepts of consolidated healthcare data. Now, this is the first step, but e-health is not yet a one-stop healthcare infrastructure spanning across different segments of care. In the future, it should be the common platform for keeping records like laboratory test records and different laboratory reports. There should be functions including making appointments and also issuing healthcare alerts and reminders to citizens. Now, I hope that the eHealth Plus will come with an AI function to help citizens to manage their health. This is the kind of smart care we are yearning for. Once again, I support the Electronic Health Record Sharing System Amendments Bill 2025. I support the policy directions. I hope that when taking forward the bill's measures, the government will ensure that all stakeholders have clear understanding of the measure. The FTU supports the development of a secure and efficient electronic health data platform which can encourage public-private partnership.
Mr. Dominic Lee, thank you, President. The healthcare system of Hong Kong has been faced with multiple challenges, including the prevalence of chronic illnesses and an aging population. At the same time, when members of the public seek help from public and private healthcare providers, their health records cannot be accessed, resulting in contradictory or duplicated treatments, which cause inconvenience. As we integrate into the Greater Bay Area, more and more Hong Kong people work and retire on the mainland. So demand for cross-boundary medical services is on the rise. We support the bill as a result. Many members have gone into the details of the bill. I will not repeat them. I think that, well, there are people who suggest that we should make reference to the following suggestions. We should mandate private HCPs to upload health information. I know that the government wants to enrich the database. At the same time, they're worried that frontline doctors may face immense pressure because of the requirement. I think that we should provide for a flexible exemption mechanism. Say, for example, if the private doctors come across sensitive information that has to do with family relationships and mental health, and if they upload such information, it may undermine the trust between the patients and the doctors, and in such cases, they may opt out from uploading such information. I think that apart from providing support to private HCPs, we should provide for a longer exemption period so that private healthcare providers can upgrade their system. Second, on data security for cross-boundary usage of health data, people are concerned about the personal data privacy, given the arrangement. Some people think that we should, say, for example, introduce blockchain technology and encrypted QR code to prevent data from being leaked or illegally edited. There is an issue of fragmentation of medical data. So this bill is one step towards our goal. I hope that the government will consider our suggestions and listen to the views of the public so that we can improve the bill. Thank you.
Does any other member wish to speak? If not, I call upon the Secretary for Health to reply. Then the debate will come to a close. Secretary. President, I thank the many members who have spoken in the second reading debate in support of the Electronic Health Record Sharing System Amendment Bill 2025, the bill for short. The bill refines the existing legal framework to tie in with and support the development of e-health. The funding support provided by the Finance Committee in 2024 kickstart the eHealth Plus development plan, which serves to transform eHealth into a comprehensive healthcare information infrastructure that integrates data sharing, service delivery, and care journey management to complement the healthcare reform. It includes promoting primary healthcare, improving workflow efficiency, and facilitating cross-boundary services. The bill seeks to expand and enhance the data collection, sharing, usage, and protection mechanism of eHealth to better support the development of eHealth Plus. Today marks the milestone of the development of smart healthcare in Hong Kong. I express my wholehearted gratitude to Mr. Duncan Chiu, the chairperson, members, the secretariat, and the legal advisor of the Bills Committee for their work in the scrutiny of the bill. On the 26th of March this year, the bill was introduced to let go. The Bills Committee has held 6 meetings to scrutinize the bill. The committee has made valuable suggestions which help our team to improve the bill. On the 11th of July, a report was made to the House Committee. Support was given for the resumption of the second reading debate of the bill. The bill, if passed, will take effect on the 1st of December this year. The bill covers 4 major areas. First, to enable citizens to have a comprehensive personal health record. Once joined, information will be able to be uploaded onto citizens' healthcare account. Citizens will still have full control over their personal data and can decide who can have access to their records. The bill also empowers the Secretary for Health to require specified healthcare providers to deposit essential specified health data into the personal eHealth accounts. The committee and the sector have expressed concerns about the implementation arrangements of the requirement and support for private healthcare sector, particularly those that are less prepared for digitalization. They asked for guidelines and support to be provided. We'll continue to work with the private sector so that there will be seamless connection between their clinical management systems and eHealth. We will also consider providing additional support to or simplified technical solutions to healthcare institutions and professionals that are less prepared for digitalization. We want to work with the sector to improve the completeness of personal eHealth accounts. When we implement the requirement in the future, we will ensure technical readiness. We will also liaise with stakeholders on the detailed arrangements, including the types of specified data, the means of implementation, and the timetable. We'll also provide detailed guidance through a code of practice and other appropriate channels to help healthcare providers understand and comply with the requirements. Secondly, the bill further supports the development of primary healthcare and gives citizens control in care journey management. To support the provision of primary healthcare services by multidisciplinary teams, the bill will expand the scope of healthcare professionals who can access healthcare data on eHealth from the existing 13 types of professionals subject to statutory registration to those registered with the accredited professional bodies under the Accredited Registers Scheme for Healthcare Professionals and specified professionals who provide healthcare in facilities controlled or managed by the government and the hospital authority. To facilitate the access and use of electronic medical documents such as medical certificates, prescriptions, and healthcare referrals, the bill provides a clear legal framework for electronic medical documents issued or authenticated through eHealth and, under appropriate circumstances, enables the government to designate eHealth as the only platform for issuing certain documents to facilitate the centralized management and use of these documents. Thirdly, subject to sufficient protection of data privacy and system security, as well as compliance with specified requirements and conditions. Recognition will be provided to individual healthcare, non-Hong Kong healthcare providers and public health record systems for citizens to authorize these professionals to access and deposit health records in their personal account. This aims to enhance the quality and safety of cross-boundary healthcare services. During the deliberations, some members have expressed concerns about security issues of cross-boundary systems, data privacy and liability, as well as measures to regulate non-Hong Kong healthcare providers. I'd like to stress that non-Hong Kong healthcare providers may only access the relevant health data with the recipient's consent in the course of providing healthcare services to the recipients based on the need-to-know principle. Under no circumstances, the records cannot be transmitted across the border. In addition, the bill stipulates that recognized non-Hong Kong healthcare providers and public record systems must comply with the specified systems requirements and conditions imposed by the Commissioner for Electronic Health Record. The bill also empowers the Commissioner to suspend or revoke the recognition if the Commissioner reasonably suspects or is satisfied that any healthcare providers or facilities has contravened the imposed conditions or that the recognition may impair the security or compromise the integrity of e-health. The bill also refines the legal provisions governing the access and use of e-health data. These include specifying that citizens and specified categories of related persons, such as parents of minors and authorized caregivers, may provide and obtain e-health records of the person concerned. President, e-health will be the core that drives healthcare reform, which enables the provision of safe, efficient, and quality healthcare services for the public. I ask members to support the second reading of the Electronic Health Record Sharing System Amendment Bill 2025 and my amendments. I so submit.
I now put the question to you that the Electronic Health Record Sharing System Amendments Bill 2025 be read a second time. With those in favour, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. Electronic Health Record Sharing System Amendments Bill 2025.